I am Taylor. I'm a fourth year PhD student. I work in David Erickson's lab, which is actually over in the mechanical engineering building. And so I did clinical immersion, what was that, 3 years ago now? So you guys will have to correct me if anything I say is entirely different now, because I know it changes a little bit year by year. But I worked, so my research is in infectious diseases. So I actually got to shadow with one of the top like HIV clinicians and researchers like in the world, which was so incredible. And he's actually like, his name is Marshall Glesby, or when you're at the hospital, you usually call him Dr. Glesby. And it was just so interesting to see everything that he did. I got to see patients with him. And yeah, and he's been a collaborator on projects and a lot of grants that we've written. And it was great to just make that connection and see that. And then since I wasn't following somebody who did like surgeries, I was able to partner up with a friend and her mentor. And so I was able to just go in and see a surgery on top of it. So just because you're not working with, a surgeon or something like that doesn't mean that you won't get to see that, as long as you look out for it.
And then I think I have Chase next.
Hi, I'm Chase. I did immersion 2 years ago, and I was mainly in the cardiology department with Dr. Robert Kim. He sees patients more for kind of regular checkups and doesn't do anything like surgeries or things like that, but he's really well connected to a lot of the other surgeons and doctors and cardiovascular interventionalists at Weill Cornell, and he's involved on the teaching side as well. So he was actually able to get me into like a lot of different spaces in cardiology, and I was able to see surgeries, I was able to see device implantations in the catheterization lab. They have a electrophysiology lab, I think, for ablation. But yeah, I was just able to see a lot of stuff, even though I had one mentor who mainly just saw patients at the clinic. So that was really interesting for me.
Great. Thank you, Chase. And then Tyler.
Hi, I'm Tyler. I am a third year in Marilyn Vandermeulen's lab. And I went to immersion 2 years ago now. So my research is in bone mechanobiology. So I was partnered with Matthias Bostrom, who's an orthopedic surgeon that specializes in hip and knee replacements. So that was really interesting because it tied in well. And Matthias has been a longtime collaborator of my lab. So it's nice to be able to like interface and spend this summer working with him. Similar to Taylor, I also was able to kind of tag along with Jason Spector, who's at Weill Cornell in plastics and reconstructive medicine. And he let me follow a lot of his surgeries that involved any type of reconstruction with like bone implants or fibula flaps, things like that. So.
Great. Thank you.
Yeah,
and last but not
Can yeah, Jason Spector is a name that you should remember because that was surgery I saw too. He's really open to letting students see his surgeries, and they're very insane surgeries in the best way.
And he's been just an incredible mentor for I think many students. Often he mentors several students in a given year as well. So he's shown he can handle it. And then I think last but not least, Nate.
Yeah, so I also attended immersion 2 years ago now, and I was partnered with Dr. Joanne Kim in cardiology, and so she mostly sees patients as well as does some work in the cath lab there. But because of her connections as well as her association with Dr. Weissef, who they work together in the same area for research purposes, I was able to also see the electrophysiology lab and the various departments within the cardiology, as well as they were able to help me meet with an anesthesiologist and have me shadow her as she did the cardio surgeries later within. So I got to see several that way. So that was very nice as well. As far as research, the research part of it was very much focused on imaging and the use of speckle tracking to look at strain in the heart though. So the research project was very interesting, and it also gives you like a different experience of like how doctors view research, much more so than we do within our labs.
Great, thank you. And so I think
Yeah.
with that, we just open the floor for questions. I just want to quickly add, I think as several had already pointed out, so even though you're assigned one clinical mentor, we really just strongly encourage you just to follow along other people as well, really just take advantage of the environment as well, just to see different procedures, get different experience as well. So your clinical mentor is essentially the go-to or the starting point, but that should not just limit you from reaching out and working with other people at the same time.
Yeah, I actually want to touch on something that Nate said about, like, I think one of the most valuable things I learned was how doctors versus researchers view research differently, and like the differences between those researchers. And like, it's really big when we're in biomedical engineering, and it's really helpful for a grant or for a paper to collaborate with a clinician, because that really adds clinical impact to what you're doing. But also there's very much like your overall goals tend to be different too. And you think that, you know, like we as researchers and as engineers can get really, really technical really quickly, and that will go over a doctor's head, you know. And it was really helpful to be like immersed in that environment and be around doctors all day, and to see like residents and people who are in training to become doctors give research presentations, and to see how that's different than how us as engineers give research presentations. And so that was one of the like most valuable parts of it. And it was amazing to me truly how different the communication was between us and between doctors.
I can also add on a little bit to what Taylor said. One thing that was really impactful for me is seeing how doctors diagnose some of the diseases that we work to treat. So for like the very first time I went to clinic, Dr. Bostrom, I showed up and he just said, we have to step outside of the clinic room because they're having a patient just walk down the hallway so he could see how their knees bend to see if they need a knee replacement. So, you know, in our lab, we induce osteoarthritis in mice. Like, I know when they need a knee replacement because I'm giving them that disease, but like seeing how it progresses clinically is something that we don't necessarily think of. And like Taylor said, it adds a lot of impact to our research and really changes the way that we view the outcomes of the projects that we work on.
There's a question in the chat.
I don't know if we had anybody here who did cancer, but I know that people have. So I know in my year there was somebody who was I think working over at Sloan Kettering, and I think it's not as common, but they're all kind of connected, and it's definitely yeah.
Yeah, I'm guessing the process is somewhat similar to working in HSS, and Tyler might know a little bit more about that. Were you in HSS?
I was at HSS, so I can talk a little bit to that. HSS is separate process from Weill Cornell. So when I got there, I had like an HSS ID and a Weill Cornell ID. So HSS has you go through like the volunteer department there and kind of deal with all of their special process, which is slightly different, but the same outcome as Weill Cornell, so it's not hugely different. So if Sloan Kettering has a similar process to HSS, you don't really have to jump through a lot of hoops to get in there. I will also say, and Jan, you can correct me on this, but we do now have field faculty at Sloan Kettering too, right? Because isn't Daniel Heller there?
So Dan Heller is there as well. And so I think, and I know, I don't know specifically from Memorial Sloan Kettering, but I know in the past we had someone, for example, working with the cardiologist at a different hospital. And I think what we did there, we essentially assigned her a clinical mentor who was within the Weill Cornell system, since that makes it administrative easier. But then also, oh, you can also spend time there now at the other hospital. And I'd imagine that's something that we could do with Memorial Sloan Kettering as well. And then really just the only other part is just the logistics and administration, just to make sure that just you get an ID, you can get in there. But I think that should be doable as well. Probably is a little harder now during COVID times, but then does it hopefully by the time the next summer rolls around, we don't have to deal with that anymore.
Another one, what was your daily schedule like during the immersion program, from Katie?
I can start if that's all right. So yeah, it really varied person to person. It really depends on like what your doctor's schedule is and if you can shadow them for everything. So there are, you got to really talk to your mentor, because sometimes they'll have patients who are kind of uncomfortable with you being in the room, or they're in some kind of private meeting and you can't go with them. And so when that happened with my mentor, usually he would just kind of take me to like the resident room. So like basically like the PhD student version of like the doctor track, where they're like almost doctors or whatever. And so I would hang out with them and I would see what they were doing, and they were kind of doing things at a like less secretive level or whatever. So I could tag along with them a lot more. And so usually I would like show up at the hospital somewhere around like 8 or 9, and then just kind of like hang out and follow people all day. The hard part is that doctors don't take lunch and they don't really eat during the day. So I'd be like following residents around all day, and then all of a sudden one of them would go, "Oh my God, you need to eat." And they're just like, they stop, they grab a coffee, and they keep going. And so you do kind of have to like watch out for that. And like, when you're scheduling things with different people, try and like leave yourself a lunch break, because if you don't prioritize that, it just won't occur to them, because it's just the life that they're used to. And then it really depends on like your research project as well. If you're doing anything physically in the lab, my project was all kind of remote and data analysis. And so kind of whenever I didn't have something interesting to see, there wasn't somebody that I was following, I would just sit down in the library that they had there, and work on my project then. Yeah, so it really depends on your clinician, but basically, 8 or 9 to 5, just kind of be in the hospital and just, take the time to just see everything you can. Like, even if you can go home for lunch, try and just stay around the hospital and like try and it's called immersion, try and immerse yourself in that environment, and try and like learn what you can from that and see different situations where we as engineers can make the medical system better.
Kind of to add on to that, I will say that it was a lot more of kind of setting weekly schedules rather than daily schedules, and figuring out kind of what are the big events this week, who's doing surgery when, what other students are up to as well, since you might be able to tag along with them if there's an extra room in a surgical suite or in a cath lab or something. And that was big. Definitely, like, I was lucky because my guy worked more in the clinic, so I was able to get lunch more regularly. But kind of with lunch, oftentimes there are lunch talks that you can go to as well. And everybody loves free food, but also the talks are usually pretty informative.
I will also add, it's a little bit self-directed based on what you want to go to. So like I wanted to go to a lot of different grand rounds that HSS had, and some of those started at 5:45 in the morning. So I would go super early some days, and then I also had a remote project, so I would just stay in the hospital and like find a spot to like work on it where I knew I would like interact with people. And Dr. Bostrom kind of let everyone know that like I'm there. If I want to join in on a surgery, let me. So yeah, it was kind of just, I would see who was passing, what was going on, and then kind of play it day by day in that sense.
Hey, Tyler, can you let people know what grand rounds are?
Yeah, sorry. So grand rounds are basically, it's similar to the idea of a seminar that we go to. So some of them would be, they held like debate style between 2 different clinicians who would then discuss the pros and cons of, say, like a certain surgical technique or something like that. Other times they would have residents give research overviews and things like that. So it's pretty much just like a presentation, but it's also where you hear the horror stories about residents getting cold called by senior doctors and asked very specific knowledge questions. So it's kind of fun seeing them panic a little bit, because knowing you're kind of immune to that is nice.
Yeah.
We got it. Oh. Did you have more? Sorry.
Yeah, so I was just going to add, in my experience, my setup was my Dr. Jawan Kim has more of like a research space area that's very much computational, but they have like everyone within the lab that stay together and work together within that environment. So usually what you would do, like if you weren't shadowing, because usually what would happen is you'd go in and they would ask like, what do you want to shadow type of thing. Is just like anywhere you want to go, you can go. But besides, like, when you're doing your research, you would just stay within the environment and work with other people. And then when you have questions about like, oh, I don't know about this imaging technique exactly, or like, you could always ask them and they'd always explain and like help you out because they're also there to learn and to do work. But anyway, just last thought. And then,
Oh, sorry.
I was just going to say, and we have another question. Are you still in contact with your clinical mentor? Is it common to continue working with them through your research?
I would say this is really dependent on your research mentor. I say that like the best way to find like a research mentor at Weill Cornell is to talk to your PI here at Cornell and see if they have any collaborators at Weill Cornell. So that way, like, you know, it is somebody that you could potentially work with. And so if there's someone who already has a connection to your lab, then it's much more common to continue working with them. I think with my mentor, like we email occasionally, he's provided letters of recommendation for me and things like that. But, you know, on a day-to-day basis, we don't specifically work together on projects.
So I'm kind of on the exact opposite end of the spectrum of I went into Immersion knowing I was working with someone that Marilyn had collaborated with for probably as long as I've been alive. So I knew that from the start, but I also knew of people that we were trying to establish new collaborations with when I went down. So I made it a point to like meet with them and chat with them. And one of them is on my committee now. So I will say that a lot of the clinicians are very, very busy. And at the end of the day, I don't want to say they don't care about their collaborations, but like setting up a collaboration with a PhD student won't be their priority. So it's kind of like, if you want to do that, it's in your best interest to be proactive about it. And I think as long as you're proactive about it, like it works out 9 out of 10 times, like it has for me. So.
So my situation was a little bit different in that I had both a clinical mentor and a research mentor, and they weren't the same person. But I am definitely still in contact with my research mentor down there. I came from a neuro lab at Cornell. I'm in Yedong Wang's lab. And so the researcher that I ended up working with, Jingli Cao, was also a new faculty member down at Weill Cornell. And I ended up working in his lab over the summer on some stuff that's kind of related to the work I'm doing now, but being able to kind of bring back new information to my PI about the stuff that he does and some of the possible collaborations that could happen meant that they've ended up working on some grants together. And so while I haven't specifically started a project with him yet, kind of the grants for that are in the works. So it ended up kind of paying off from that point of view.
And with my project, it wasn't, my area of research was, I went to clinical immersion before I had a PI because I had gone before I actually started at Cornell, the PhD program, not like most of the others. So when my selected like clinical mentor isn't exactly in the area that my project space is. So it's a little weird to work, but however, in the future, there's definitely the ability to collaborate. I'm not entirely sure based on my current trajectory with my project that will come to fruition though. But it's definitely possible if you, like Tyler said, you have to be proactive in seeking that out and looking for it.
Yeah, and I think regardless of whether you physically work with them on research, they're still a very important part of your network. And I know that I have those connections. And you know, if I potentially wanted to go work in New York City, these are definitely people who I would reach out to and say, you know, how did you get your job? How did you decide? You know, can you kind of give me advice on that? And so they're very important parts of your broader network too, even if you don't work with them directly.
And I can just to add a few from other students who are just not here on the call. I know that it really depends a lot on the research part, the specific mentors. I know some of the people who work with Aaron Spector, for example, they continue to get samples from him that they use in their research as well. There's, I think, other students where it really is more just there. You use that experience and then basically take that and go home with it, and you don't basically revisit it. So it really depends very much, I think, on the individual connections and on your research as well. And they have, I think we did a survey at some point just to see in terms of what presentations came out of it, publications. I think we did actually in the end have quite a few publications that have come out of it, but again, I think it's going to be very context specific, where I think it will apply to some of the interactions, but not to others.
Yeah, I think I'd love to comment just on the program like a little bit more broadly, right? Like, I mean, you're there to be immersed in the hospital and see everything you can, but also it is a very nice experience to see New York City. I absolutely would never have spent that much time in New York City if I was not forced to. I decided long ago that I am not a city person, but I also did, really, just to see New York City and to know like what all of the buzz is about, like even if it's not a place that I want to live in the future, it's a really good way to just try it for a few weeks, and then I can be 100% sure that that's not where I want to live long term. And it's also like the cheapest you're ever going to be able to live in New York City on top of that. And so just take advantage of it as a broad experience in addition to being in the hospital. Like, yes, be in the hospital when the hospital is like open in its main hours, but then usually in the evenings, like a group would get together and you go try all of the amazing food, go see the different parts of New York City. I spent so much time in Central Park because there were days where I was just like, oh my God, I haven't seen enough trees or greenery. And so I knew the path to Central Park like the back of my hand. And it was, just the city itself was a great experience. And it was like an ideal amount of time where like you don't quite get that if you're just being a tourist. And just long enough that I was very ready to come home. And so I just take it as a broader experience too. And I think it's one of the really unique things about this program, that they have this collaboration set up and the opportunity for us. And so, yeah, just look at it as a really big opportunity for a lot of different things.
I can also add to that, if you're kind of the opposite of the end of where Taylor's at, of you loved being in the city, I think Cornell and our department is pretty good at like establishing collaborations and providing you resources if you wanted to do work in the city as well. So like after immersion, like I went down to the city multiple times to meet with our like new collaborators and stuff like that. Like Marilyn went down with me and introduced me to people, and I was still able to go there. Cornell made it pretty easy. I mean, I just got my project funded through what's called an intercampus seed grant. So like they really do foster collaboration between Cornell Ithaca and Weill Cornell.
Kind of going off that, does anybody have like a favorite thing that they did outside of the hospital in New York City, or thing that they saw?
On the 4th of July, I went to the beach and got sunburned. That was really fun. It was great.
I went to the Met probably like 5 or 6 times and still didn't finish it. So
You even got in after hours too with your doctor, right?
Did I? I might have. I'm not sure.
I thought that Spectre took some of his students to like some special hours
I
thing.
didn't go for that, no.
Okay.
I did go after hours another time, but not with Spectre.
Okay.
I was a big fan of Broadway, and they have like a like lottery ticket system, so you can get like $20 tickets if they have like extra spaces. And so I saw a couple different Broadway shows so I would highly recommend like decide like what your budget is, because you can definitely like go way over. And I didn't see any of the like super popular ones at the time, but just see something because it's such an experience, and definitely check out the lottery. And if you and your friends are entering the lottery like every day, like we were, like somebody will win at some point. I think we had multiple people win like the time we were there. And so that was really fun. I was in Central Park literally all the time because it felt the most like home. Like if I could have pitched a tent there, I would have.
It was only 6 blocks away.
I would have rather it been no blocks away. But yeah, and I love the food, just like trying different foods and just wandering around. Yeah, there's something for everyone. I also like the only time that I went back after that, because the only thing I didn't get to do while I was there was see like a taping of John Oliver, but like all the late night hosts go from there, and so you can get in to see, like, they have live audiences. You can get into like the taping of their shows if they're running at that time, and so I definitely would recommend that if you're fans of those shows. They're really cool to see in person.
Yeah, I think my favorite was going and seeing Seth Meyers in person and getting to pass through like a lot of the stuff where SNL is and getting to see all those stages. That was a
Yeah.
lot of fun.
Going
And
through
then,
that area with Chase was fun. I
yeah.
agree.
Yeah, no, that was a fun evening. And then there's a lot better shopping in New York City than Ithaca and probably pretty much anywhere. So always fun to do that.